Welcome to Hersing University NU 640 Introduction to Women's Health Across the Lifespan. This video will discuss Chapter 30 from your Alexander and Colleagues textbook, as well as Chapter 22 from your Sarkio and Sikor text. This discussion will serve as a brief overview of the material. Therefore, I would like to ask that you please read the chapter for additional and required information. Additionally, I would like for you to review all other required and supplemental resources. This presentation will be represented by myself and Dr. Alicia Sutton. I would like to begin with stating that both of our required textbooks now use the term sexually transmitted infection, or STIs. However, there are many other professional organizations and articles that still use the term sexually transmitted diseases, or STDs. Therefore, we will utilize the terms interchangeably in our discussions. As your text explains, sexual relations are a natural and healthy part of a woman's life and should be free of infection. However, sexually transmitted infections are a substantial health challenge in the United States, and preventing, diagnosing, and treating STIs have become even more challenging as an increasing number of persons are infected with more severe infections. Preventing, identifying, and managing STIs are essential components of women's healthcare. You, as the provider, will assume an essential role in promoting women's reproductive and sexual health by counseling women about the risks of STIs, encouraging sexual and other risk reduction measures, and being familiar with assessment and management strategies related to STIs. In doing so, you can assist women in avoiding STIs and in living better with the effects and chronic infections of STIs.
You know from your readings that STDs are among the most common infectious diseases in the United States today. The Centers for Disease Control and Prevention estimates that nearly 20 million new STDs occur every year in the United States, with half being among young people aged 15 to 25. It's important to note that individuals with an STD are often undiagnosed, regardless of whether they are asymptomatic, and are a huge risk for spread of the infection. In 2015, the CDC estimated that at least 1 in 4 and possibly 1 in 2 Americans will contract an STD during their lifetime. Now, STDs are not any one specific disease. Rather, the term refers to a variety of clinical syndromes caused by pathogens that can be acquired and transmitted through sexual activity. STDs may be caused by a wide spectrum of bacteria, viruses, protozoa, and ectoparasites, which refers to organisms that live on the outside of the body. STIs have a greater and more long-lasting impact on the health of women than on the health of men. STDs in women and children are associated with multiple severe complications and even death. Consequences for women and children can include cancer, reproductive health problems, pregnancy-related problems, neurologic problems, and other health consequences such as liver disease and septic arthritis. The chance of contracting, transmitting, or suffering complications from STDs depends on multiple biologic, behavioral, social, and relationship risk factors. That is, microbiologic, hormonal, and immunologic factors influence individual susceptibility and transmission potential for STDs. These factors are partially influenced by a woman's sexual practices, substance use, and other health behaviors. Health behaviors, in turn, are influenced by socioeconomic factors and other social influences. As we have learned in earlier units, preventing infection is the most effective way of reducing the adverse consequences of STIs for women, their partners, and society. With the advent of serious and potentially lethal STDs that are not readily cured or are incurable, primary prevention is critical. Prevention and control of STDs are based on 5 major strategies that include accurate risk assessment, education and counseling of persons at risk on ways to avoid STDs through changes in sexual behavior and use of recommended prevention strategies, pre-exposure vaccination of persons at risk for vaccine-preventable infections, identification of asymptomatically infected persons and persons with STDs, effective diagnosis, treatment, counseling, and follow-up, and evaluation, treatment, and counseling of sexual partners of persons who are infected with an STD. All women who are sexually active should be screened regularly through history, physical examination, and laboratory studies. To identify those at risk, specific questions should be asked during the collection of a health history. Risk assessment will depend on a woman's willingness to self-identify risk factors that may be seen as socially unacceptable or stigmatizing. Some women may not reveal such risk factors directly to you, but are willing to do so if asked. So how do we start the conversation? Remember that some patients may not be expecting a sexual history, and the topic will need to be introduced to them. For the man with urethral discharge, you're already in the area, so he's probably expecting some questions about his partners and sexual practices. But for the teen who's in for a sports physical, or the young woman who would like a contraceptive pill because she has a new partner, or the patient with HIV you've been following for several years that is simply there for a 3-month follow-up, you will need to bring the subject up. So I encourage you to use a transition statement that acknowledges the sensitive nature of the questions you're about to ask, assures confidentiality, and points out to the patient that these are important health issues. So use a statement something like, I'm going to ask some questions about your sexual history. Or, I know this is very personal information, but it involves important health issues, and everything we discuss will remain confidential.
The content of sexual history should be familiar to you, as we have covered it in a previous unit, and you have the foundation from your Advanced Health Assessment course. The CDC STI guidelines that were published in 2021 provide us with a handy way to summarize and remember this content. The CDC recommends using the 5 Ps, which consist of partners, practices, protection from STIs, past history of STIs, and pregnancy intention. I have provided you with a link to the CDC's Clinician's Quick Guide discussing sexual health with your patients handout in your supplemental resources.
We are used to using open-ended questions to elicit the patient's chief complaint, such as what brings you in today or what can I do for you? But then we tend to revert back pretty quickly to a direct interview. So a paper that I read a while back talked about a study done to time clinicians to see how long that they let the patient talk at the beginning of the interview. The result was about 7 seconds. Almost any yes-no question can be easily turned into an open-ended one by beginning it with tell me about. So tell me about, do you have any discharge? Tell me about any symptoms you have. Have you ever had an STD? How about converting that to tell me about any STDs you've had in the past? Another question would be, have you ever tried to quit smoking? How about converting that to tell me about how many times you've tried to quit smoking? It's also important not to make assumptions. Perhaps the most common assumption that providers will make is in regards to the number or gender of partners. So if your patient comes in and states, my boyfriend asked me to get an STD check, you're still going to need to ask, are your partners men, women, or both? Have you had sex with guys or girls or both? Then it's important to ask how many partners the patient has had recently, say in the past 2 to 3 months. And next you can ask the specific questions about sexual practices. Avoid using the term regular sex to refer to vaginal sex, because that means everything else is irregular or abnormal. Most patients will understand the proper anatomical terms, vaginal, anal, or oral sex. For the patient who doesn't understand and ask, what's that? You will need to be very direct.
A few things to consider as we move on. When taking a sexual history, use an unrelated translator. It is good practice to utilize a professional service whenever possible, but especially when taking a sexual history. Have an open manner about you, with lots of active listening cues, like head nodding and eye contact. Avoid showing surprise or dismay at what the patient tells you, and as you know, remain non-judgmental. There are many great tables in your Alexander and Colleagues textbook that can assist you with further reviewing the risk assessment and STI history.